My name is Grace Scott, and my title is CNA, and I work at Hospice of the Valley. The organization, it's a non-profit organization. We just give comfort and treat their pain and make them comfortable. I'm a CNA. Classes in nursing, but I'm practicing as a CNA. I went to school to Glendale Community College. I look forward to come to this job. I enjoy it a lot. I've been doing it for 42 years, and I haven't got tired of it yet. I really enjoy my job. I really recommend people who, you're just getting started, to come and help us. Like Lucia, she starts a volunteer. There's a starting for you to get knowledge on what this job is all about, and it helps you out to make a decision whether you're going to like it or not. And I think pretty much it makes people help out to make up their mind. Once they come to this job, it's a wonderful job. People are really appreciative of what you do for them, and it gives you it just a sense of living. You just learn so much from what all these people goes through, and I guarantee that people who comes here, they end up loving. It's about giving love and care, and people who are giving and loving, and they just enjoy doing this kind of job. And like I said, I've been doing it for 42 years, and I still enjoy my job. So you certainly have to like what you're doing, to enjoy it. But this is not a very hard job to do. Background, I started doing this when I was only 15 years old. I started really young, and I have done a lot of, I have worked for the veterans of the Vietnam War. I have done mainly hospice. I worked for St. Joseph Hospital and the hospice for 6 years, and I have done so much hospice. That's mainly what I concentrate on, doing hospice. Like I said, altogether I've been doing it for 42 years. Well, actually it's 43 years. I started in 1970, and so I grew old at doing this, but I really enjoy it, and I have done so much, too many hospice in the Valley, in Phoenix. I have done a lot of hospice. Mainly just hospice, and it's just loving and caring for the patients. We do almost everything. We do the evaluations, we do the patient care, we do vital signs, we do everything, except the only thing that we don't do that is different from the nurses is we do not distribute any medications, because what hospice is all about, it's mainly in these patients narcs, and it's like morphine, and we have to have a special license to do that, and we don't have that. But mainly that's the only thing that we do different from the nurses. Don't do the many meds, but other than that, we cook, we clean, we do evaluations, we do admissions, we do everything that you can think of. We are cross-trained to do just about anything that the patients, as far as the patient's needs concerned. Okay. No, I'd love to do everything about hospice. It's really nothing I dislike. It's something that makes me a little uncomfortable about when we get patients and then we get so close to them, we get attached to them, and then the patients die, because this is all, that's all about, people, patients dying. And then I wish I can have more knowledge on comforting them, and it's about the only thing that makes me a little bit uncomfortable. But I wish I can have more knowledge to calm them to, to overcome their pain and whatever they go through when their family members, died. Other than that, I feel comfortable about helping them up with anything, The advice that I would give anybody who wants to come and work for hospice is to start here, because it's a good start. If you decide that you're going to like it, it's more likely that you are going to continue on. If you decide that you're not going to like it, you haven't lost anything, you can go on to your career to do something else that you really like. But the advice that I gave him, that you must like what you're doing in order for you to make it go much easier on you. And when you have really hard days and they are really tough and you enjoy the job, it will look just like a piece of cake, Nothing else putting the job through, So that's the main thing, because in all the years that I have done, I've been on the field or at the units or whatever, I realized that when I have really bad days, they don't seem that bad compared to, sometimes we complain about we have problems, but when you see some of these people having the problems that they have and going through the illness and everything, then your problems don't seem much compared to them.